Hi everyone, this is Heidi Green, author of the blog Living a Blissful Life here on Healthy Place. And today I'm going to be talking to you about EMDR, that is eye movement desensitization and reprocessing. Now, EMDR is a therapy technique that therapists use usually to help people reprocess trauma that they've experienced. The research on EMDR actually shows that we can use it for a lot of different reasons. So when people have negative feelings about themselves, addictions, negative emotional states that they're stuck in, anything really where someone gets stuck, not just trauma, can be processed through EMDR so that people can feel relief from their distressing thoughts or distressing emotions. Now, I'm excited to talk to you about EMDR because I've been on both sides of the couch in terms of EMDR work. I have been both the client working with an EMDR therapist, doing my own trauma work, and many of you know I'm a clinical psychologist, so I've also been the EMDR therapist. So I wanted to tell you a little bit about what it is and how it works so you can get a feel for it. So back in the 80s, when this was discovered, therapists would hold up their fingers like this and move it back and forth so that clients could follow along with their eyes like this and get that same kind of bilateral stimulation that happens in the brain during REM sleep. So we've learned over time that there's nothing magic about the eye movement and that you can actually get the brain firing bilaterally with alternating sensations on each side of the body that can happen in different ways. So when I'm doing EMDR with clients, I use one of these little contraptions. I turn it on and it delivers a little vibration. Now you can see I do have the lights on mine so that people can do the eye movements if they want to, but oftentimes what people do and what I do in my own is just hold them so that I can feel the vibration and just close my eyes and get a good image in my mind's eye. So when somebody is doing EMDR, you and your therapist will choose a target, and that target is going to be something that represents that stuck point in your brain. And then after you've developed the target, you'll hold the buzzies or do the eye movements, and your therapist will guide you on kind of an imagery kind of exercise, a visualization exercise. And you'll allow your brain to fire bilaterally the way that it solves problems best, makes sense of things best, and you really just let your brain do what it does. And you give it the space to reprocess, reorganize, and reduce distress around the target that you've chosen. So if you're working with a therapist, you might want to check in with them and see if they've been trained in EMDR and whether or not they think EMDR would be a good fit for you. Thanks everyone. Bye-bye.